गोयांत पहिली अँकल रिप्लेसमेंट सर्जरी जाली। गोयची पहिली अँकल शस्त्रक्रिया राज्यातल्या आर्थोपेडिक काळजीत महत्वाची उदरगत करता। कार्टिलेजाक लागून पायाच्या घोट्याचे त्रास जाल्ल्या 45 वर्सां पिरायेच्या एका दुयेंतीची पुराय पायाच्या घोट्याची शस्त्रक्रिया केली। आर्थोपेडिक केअर इज अ माइलस्टोन अशें स्वित्झर्लंडांतल्यान गोयांत सर्जरी करपाक आयिल्ल्या डॉ. बीट हिंटरमॅनान सांगले।
Goa's first total ankle replacement surgery at L3 hospitals, and this was done on 2 patients back to back, and both these patients were suffering from ankle arthritis. Usually the ankle joint is one of those joints which does get damaged in a simple ankle sprain, or it could be a very violent fracture, or it could be some sort of a sports injury. But if these injuries eventually cause a lot of damage to the cartilage, they might end up with a long-term pain and disability. And this arthritis then eventually becomes so painful that the patients then have a compromised lifestyle. Their walking distance becomes compromised, their ability to move around using stairs, everything becomes a problem. So both these patients were actually having injuries almost 15 years back. They're not fresh injuries. And they have been looking out for a solution. They have visited many doctors all over the world and also in India. So to give you in short, total ankle replacement has started in India just for last 2 years.
There are some situations that make a patient impossible to get a normal life, quality life, such as pain or limitation for the movement. But nowadays we know that the minimum of activity that we need is to get a normal walk. And these patients are not able anymore to walk in a normal situation without pain. Living with pain is not living. So this is the main concept for us, to relieve the patients from the pain. And the other is the demanding activity that every patient can have. So some of them want more activity. We have to study the situation and give them the possibilities. Some of the patients are totally unable to do other activities because they are very old. So we give them also the possibility to improve their normal life.
First of all, an ankle osteoarthritis is not a simple problem of the joint itself, but also around the soft tissues and the joints around, and very often ends up in a complex problem with deformity and instability. So both cases were very complex cases where the ankle prosthesis was just a part of the surgery. That means the worn out cartilage, that means arthritis of the joint, was treated by implants, but to get it work, to get the foot stable and balanced, it needs to be aligned and stabilized.
GOA365 खातीर डायलन रॉड्रिगीस, गौतमी गांवकार आणि ओमकार देशप्रभू।